Assalamu alaikum and very good day. Welcome to UITM CDE Dentistry. This is micro-credential course UMC 581 Cracks and Fracture. The specific learning outcomes for the participant that join this program, they should be able to learn from this lecture and understand the importance of cracks and fracture, discuss the prevalence of cracks and fracture, discuss the etiology of cracks and fracture, classify cracks and fractures. In the introduction, we will introduce what is cracks and fracture and its importance. In a study done by Friedman in 2016, found that 49% of endodontists has seen an increase of cracked teeth and vertical root fracture compared with the previous decades. In two studies done by Goodson and Mamoun, found that cracked tooth is the third major cause of tooth loss after dental caries and periodontal diseases. Cracked tooth is the common dental hard tissue. The crack is the way for the bacteria to invade the pulp, and the deeper the bacteria colonize the crack, the more serious the pulp inflammation. And in subgingival cracks may lead to isolated narrow deep periodontal pockets that can act as a pathway for bacterial invasion, which ultimately lead to a tooth loss. Crack, when left untreated, can propagate into fractures, resulting in catastrophic failures and tooth loss, such as in the incidence of split tooth. For a patient with a cracked tooth, if the condition is not controlled in time, the gradual deepening of the crack may cause pulpitis and periodontal diseases. Therefore, the timely and appropriate diagnosis and treatment are essential in order for preserving the affected tooth and reducing the pain of the patient. However, due to concealment of the crack in the early stages and the complex manifestation of the crack after combined with pulpitis and periodontal lesions, the cracked tooth is easy to be confused with other diseases, resulting in difficulties in clinical diagnosis and treatment. Therefore, how to effectively diagnose and treat cracked tooth has always been a hot and tough issue concerned by many clinical dentists. In this section, we will discuss few aspects of crack and its location. In a study done by Ozona in 2021, the age group of the people with a cracked tooth was the highest at 45 to 55 years old at 22%, followed by the age group of 55 to 64 years old at 20%. People of white ethnicity background were the most people represented with a cracked teeth at 58.9%, followed by Hispanic people at 28.4%. The prevalence of the cracked tooth according to the tooth type showed a near equal distribution of cracks of the maxillary teeth to the mandibular teeth. Tooth types that most likely associated with the crack were the first and second molars, consisting of 59.8%. In the mandible, the first and second molars represented a large number of cracked teeth in the arch and overall oral cavity, while in the maxillary arch, the first premolar and first molar were the most cracked teeth in the arch. The most commonly reported anatomical location of the crack was in the crown, accounting for 62.3%, while 2.6% were reporting in the root. Vertical cracks were reported as the most common crack orientation, and teeth with amalgam restoration had a higher reporting for cracks in the tooth when compared to teeth with resin composite restorations. The symptom associated with the crack showed that pain was the most common descriptor, followed by thermal sensitivity and pain upon biting or chewing. In this section, we will discuss the possible causes of cracks. The etiology of cracks mainly include large and complex filling, defective cavity designs, development defect of fossa and groove, abrasion, dental erosion, caries, excessive occlusal forces, parafunctional habits such as bruxism and occlusal trauma. The clinical symptoms of teeth are usually related to the depth and direction of the cracks. Nevertheless, the diagnosis, the treatment, or the prognosis of affected teeth has always been a challenge for clinicians. In this section, we're going to talk about the classification of cracks and its different forms. The first type of crack classifications is effraction. It is a V-shaped loss of hard tooth structure caused by biomechanical loading forces such as from flexure and or chemical degradation of enamel and dentine at some location distant from the actual point of loading. This is the most common place where effraction occurs. They usually occur at the cervical region of the tooth, whether it is into the root part or sometimes extending to the crown part. We're going to talk about infarction, which is also known as a Craig line. It is a crack of the enamel without the loss of true structures. In this picture, you can see here there's a Craig's line. This is the second one, and this is the third one. The Craig's line is limited to the enamel, does not extend into the dentine, and since it is limited to the enamel, the amount of the bacteria colonizing the enamel is minimum and does not extend to the dentine. Therefore, the patient does not suffer from any symptoms. Okay. Crack tooth is a thin surface disruption of enamel and dentine and possible symptom of unknown depth and extension. This is a crack. And depending on the extension of the crack within the enamel and dentine, the symptoms the patient suffer might vary. And depending on the extension of the crack, whether it is involving the pulp chamber or not, the treatment might be different. And depending on the extension of the crack, whether it is limited to the crown only or extending subgingival into the root, the treatment and prognosis might be different and vary from tooth to tooth. Fracture is defined as split or break in bone or cartilage, but when involving tooth fracture is disruption of the enamel, dentine, or cementum that is assumed to be a greater depth than a crack of unknown depth, extension, visible or not visible clinically or radiographically with a separated or unseparated segment. Therefore, the crown can be limited to the fracture can be limited to the crown, or it can be extended deeper into the roots. And depending on the extension of the crack, patient suffer from different symptoms. Root fracture is a fracture that exists or extends into the root to include the dentine cementum and possibly pulpal space, which may progress to or from the enamel. Usually it is located only around the root and does not including the crown. Okay. Longitudinal fractures are fracture extending to the axial plane within the tooth, which is divided into two types. The first type is vertical root fracture, which is a fracture in the root whereby the fracture segments are incompletely separated. It may occur buccolingual, mesiodistal. It may cause an isolated periodontal defect or Sandner's tract. It may be radiographically evident. You can see here there is a crack line that is within the root, and on the x-ray is also evident on this side. You can notice that even though there's a fracture within the root segments are still intact to each other. The other classification of longitudinal fractures is split root, which is a continuation of a crack or vertical fracture, whereby the fracture segments are completely separated longitudinally. It may occur buccolingual or mesiodistal. It may cause an isolated periodontal defect, Sandner's tract, and it may be radiographically evident. In this case, you can see that is a root canal treated tooth with a fixed prosthesis and pos and core, and the distal part of the distal root is separated totally from the root, and the crown. In this diagram, I'm showing it to compare and show the difference between vertical root fracture and split tooth. In the vertical root fracture, you can see the fracture is a one line, but it doesn't go throughout the whole root. While in the split root, it is a line that going through and through the root. It might be into buccolingual direction or mesiodistal direction. That's all for this lecture, and we will continue with the next unit. Thank you.